My name is Shanker Pasupathy. I'm a surgeon with a special interest in gastrointestinal and vascular surgery. Today I would like to speak about hernias. An unusual type of hernia can occur in the diaphragm, which is the muscle that separates the chest cavity and the abdominal cavity. The important structure that passes through the diaphragm is the esophagus, which is the food passage connecting the mouth to the stomach. So as the esophagus passes through the diaphragm, there is a hole in the diaphragm which allows the esophagus to expand and contract as it carries out peristalsis, pushing the food downwards. Now, sometimes that hole in the diaphragm, also known as the diaphragmatic hiatus, can be stretched out, and this is often correlated with obesity. It is correlated with persistent straining, vomiting, or perhaps as a previous incident of trauma, maybe an accident, or maybe some assault or a punch in the guts. This can lead to tearing or stretching of the diaphragmatic hiatus. Another reason why hiatal hernias develop is also because of excessive eating, where the stomach is stretched out excessively, and this leads to stretching out of the defect in the diaphragm because the stomach keeps pushing upwards through the diaphragmatic hiatus. When there is a hiatal hernia, this can lead to food and gastric juice propelling upwards into the chest. The acid that enters into the esophagus can burn and excoriate the esophagus, giving rise to the sensation called heartburn. Sometimes it can lead to difficulty in breathing, especially when lying down at night after eating a heavy meal. So these are quite typical symptoms of acid reflux, and usually manifested because of a diaphragmatic or hiatal hernia being present. Now, in fixing this, the first step we do is actually to encourage people to eat smaller meals, because if we eat a smaller meal, it's possible that the symptoms can subside, because then food goes all the way down to the stomach, far away from the diaphragm, and that gives enough space for digestion to occur without acid and gastric juice being propelled up into the esophagus. However, if the diaphragmatic hiatal defect is large, it may be necessary to repair it, to tighten it, as well as to reduce the stomach properly back into the abdomen and prevent it from moving up into the chest. So hiatal hernias are usually fixed by a keyhole technique, where 3 or 4 punctures are made in the abdominal cavity, a camera is inserted, and the stomach is held from below and brought downwards. A mesh may or may not be used to repair the defect in the diaphragm. Most times I prefer just to use stitches directly to close and tighten the diaphragmatic hiatus. A hernia refers to a defect in the muscle, and typically we are referring to defects in the muscle wall at the abdomen, which can be on the front of the abdomen as well as above the abdomen in the diaphragm, which is the muscle separating the abdominal cavity and the chest cavity. Typically, you will feel a hernia as a lump which emerges often in the groin, especially for men, and for ladies it's often seen in the belly button area. Even men can have it at the belly button area. So this lump is actually the bulge of the abdominal contents pushing through because of this weakness in the muscle wall. Usually, other than seeing the lump, sometimes you can feel pain, especially when straining to pass motion, straining to carry things that are heavy, or coughing, sneezing, or even laughing. Usually when there is a hernia, because there is a defect in the muscle, it will require to be closed and repaired in some way. If we just leave it alone, chances are the hernia will persist and over time will get bigger. Now, if someone is quite elderly and not very active, not moving around much, spending time in a wheelchair or on the bed, then perhaps we can just leave it alone. But if you are young, fit, active, you exercise or run around, dance, sing, do something that requires you to move about a fair bit, then it is better to repair the hernia sooner rather than later. Usually when we repair a hernia, we will make an incision directly over the hernia and place a mesh, which is a little bit like a mosquito net, which is sutured or stitched onto the muscle to support and strengthen the muscle. Now, sometimes the muscle is strong enough that it can be repaired directly without using this mesh. The other way of repairing a hernia is not to make a direct incision, but to use a keyhole technique. In the keyhole technique, a camera is placed into the abdominal cavity or into the muscle layers, and gas is introduced to separate the layers out so we can identify the defect accurately. Once the defect is identified, then the mesh can be placed to cover the defect, and because it is a keyhole technique, usually we will use a special device to staple, anchor, or perhaps even to glue the mesh onto the defect. So both open surgery as well as keyhole techniques can be used to repair a hernia. Gallstones are emerging as a very common problem in Singapore. 20% of Singaporeans are believed to have gallstones in their gallbladder. Now, I just want to take a step back to understand what the gallbladder's functions are. The gallbladder is an organ situated just below the liver, and its job is to hold and concentrate bile that is produced by the liver. Now, this bile is very important to help us to emulsify, which is the process of breaking down and digesting fats. So bile is a little bit like soap that you use to wash your hands when they're oily. So bile helps the fat in our diet, the fats and the oils, to be broken down into smaller particles, and this can then be absorbed and digested in our intestine and enter into our blood circulation. So the importance of the gallbladder is to store the bile so that when we have a meal, the bile can be released quickly so that the fat in the meal can be emulsified and digested. During the process of storing the bile in the gallbladder, sometimes the pigment in the bile gets concentrated to the point that it crystallizes out as stones. So that leads to a kind of stone called pigment stones, which are usually black, greenish black in color. Another kind of stones that can form is referred to as cholesterol stones. These are usually whitish or yellowish in color, and that usually forms because of high amounts of cholesterol in the bile, which precipitate out and form these whitish stones. Now, whether you have white stones or black stones, cholesterol stones or pigment stones, the symptoms caused by these gallstones are very similar. In the first instance, most people will feel a cramping pain. The reason you feel a cramping pain, if you think of the gallbladder as a small water bottle, and if you think of the stones in the gallbladder just like little pebbles or rocks inside a water bottle, when you try to pour water out of a water bottle, you'll find the stones will get jammed at the neck or the mouth of the water bottle. So the same thing happens in our gallbladder, where the stones will get trapped as the gallbladder is contracting after you eat a meal. So these symptoms of cramping pain typically will occur within half an hour to 1 hour of eating a meal, especially if that meal has a high content of oily or fatty food inside. Typically after fried chicken or curry or even oily fish, this can all contribute to the symptom of biliary colic, which is the cramping pain that happens when the gallbladder is compressing against these stones. Now, pain by itself may not be such a serious problem, but if these stones fall out into the bile duct, they can lead to blockage of the bile flow, and that gives rise to jaundice or yellowing of the eyes and the skin. So that is a very important symptom. In fact, I would call it a critical symptom, because if someone has jaundice, then it is quite possible they may be at risk of getting infection in the bile ducts or in the liver. and that situation is cholangitis, and it can potentially be life-threatening. The other problem that's very serious that can happen from gallstones is the stones can fall down into the bowel duct all the way down to the pancreatic duct opening and lead to a condition called pancreatitis. Now that is also a potentially severe and life-threatening condition. So if you do experience cramping pain after meals, it is best to go and get evaluated. A simple ultrasound will be able to tell you whether or not gallstones are present. A lot of people believe that if you have cancer, you will have excruciating pain. Actually, that is a myth. The pain that you get with cancer may actually be very mild. It is more important to look out for other symptoms like nausea, bloating, changes in bowel habit, vomiting, especially if the vomiting has blood, or passage of stools with blood. These are much more important symptoms that can point towards something serious going on inside than pain. If you have a family member who has cancer, it doesn't mean that you have a 100% chance that you will have cancer. So rest assured that you may be free of cancer. However, if you have a family member who has cancer, it is imperative that you come in for early screening, because it is much better to pick up a precancerous lesion rather than be saddled with a cancer diagnosis. A lot of people believe that it's eating of processed food and preservatives that leads to cancer. Now, the truth is, there is no specific food that will directly cause cancer. However, even if you have a normal and healthy diet, you may still be at risk of cancer. So the bottom line is, if you are concerned about having cancer, the most important thing you can do is come in for early screening so you can have early detection. You may have heard people say that if cancer doesn't kill you, then the surgery and the chemotherapy surely will. Now, that is absolutely a myth. In modern medical practice, we have so many technological advances that allow us to do treatment in a very minimally invasive way. For example, during screening, we carry out endoscopy, and that is just passing a scope either through the mouth or the bottom end, which will be able to identify small growths called polyps before they can turn cancerous. These polyps can be removed during the endoscopy, and that will save you from needing surgery later. Now, even if you have a cancer diagnosis, most of the time surgery nowadays is carried out using keyhole technique, which is placing about 4 or 5 punctures in the abdominal cavity. The tumors can be removed and the organ can be repaired and reconstructed fully without needing any large incisions. In fact, in the last 100 operations that I have done on the stomach, everyone went home within 4 days from the hospital. You may have heard that if someone is diagnosed to have cancer, then they must completely avoid sugar or anything delicious for the rest of their life. Now, that is another myth. Yes, it is true that sugar and high energy foods will provide nutrition for cancer cells. Many people who have been diagnosed to have cancer actually suffer in the treatment and aftermath because they've been told that they are not allowed to eat any sugary foods or anything delicious at all. Now, that is certainly a myth. If you have cancer or you know someone who has cancer, it is important to see a dietitian who specializes in cancer nutrition so that you can get correct and accurate advice about what foods to eat and what foods to avoid. You may be surprised at the wide range of nutritious foods that are actually available for you to consume.